Hello everyone. Today we are going to talk about what is patient-centered care is. Patient-centered care and what it means to all of us who are working in the healthcare team. Patient-centered care recognizes that patients are people first and should not be defined by their diseases. A patient-centered healthcare system helps people to make informed decisions about managing their own health and care. It recognizes that the person's experience also taken into account their family members, caregivers, and providers. It includes deciding when to invite others to act on the person's behalf. And most of it all is acknowledging that a person's live with the conditions 24/7, 365 days, and not just the time they are seeing the healthcare system. There are three desired outcomes of a truly patient-centric system. They include a better overall healthcare experience within the healthcare system, greater satisfaction with the quality of care, greater likelihood of better health outcomes. This requires everyone in healthcare services to work in partnership to deliver care responsive to the person's individual abilities, needs, and preferences and goals. To achieve a person centered approach to care, we need to promote patient engagement and activation. Activated patients are armed with the skills, knowledge, and motivation to participate as effective member of the care team to the extent they are willing and able. An outcome of engaged and activated patient and caregiver is an improved it results in improved patient experience. Now, not everyone in healthcare works directly with patients. If you don't, you may think that patient-centered care doesn't directly apply to your work. But keep in mind that in a patient-centric system, patient experience is defined as a sum of all interactions. These interactions influence patients' perceptions across the continuum of care. They can be classified into six domains: respect for patient preference, for example, where family members are involved in care; coordination and continuity of care, for example, did the patient know what is the next step in their care or who to go with the questions. The patient should also be knowing what are the emotional support that is available, and like for example, did the patient receive the information they wanted and needed on emotional and relationship changes. Physical comfort, for example, was the patient given enough information on possible side effects and how to handle them. Access to care, for example, what is the patient experience with the wait time for treatment. Information, communication, and education, for example, were test and treatment explained so that the patient could easily understand the results. Did the patient receive enough information to make informed decisions? So think that for a moment. Does your work have an impact on any of the six domains? Could a pers- could a more person-centric approach in your work take patient preferences into greater consideration? Could you take steps to improve the person's coordination and continuity of care? Are you able to provide more emotional support or physical comfort? Could you provide more information that the person or their family may find it useful? Bringing person centered care to life is about identifying key behaviors that can be embedded in daily routines. It's about breaking down the checklist into a few manageable items that can be incorporated into your delivery of services. To be a person centered is the responsibility of everyone whose role impacts or interacts with the patient and families. It's a lot to think about knowing how to shape each and every interaction so that it contributes to patient centered care. The key things what we need to remember regarding patient centered care is knowing the patient as an individual, understanding the essential requirements of care, tailoring healthcare services for each patient, continuity of care and relationship, enabling patients to actively participate in their care. By following these guidelines, You will see a patient as an individual and focus on the whole person within the whole healthcare system. We all take pride in our healthcare system and our patients. Thank you.